Hi everyone, and in this video I'll be discussing anti-protozoal drugs. So when we talk about protozoa, the most important ones are amoebiasis, then trypanosomiasis, then we have leishmaniasis, cryptosporidiasis, isosporiasis, cyclosporiasis, so toxoplasmosis, and we have a separate protozoa that is malaria, and we'll discuss that separately. So in anti-protozoal drugs, the first thing what we are going to discuss is a group of drugs, and these are called as nitroimidazoles. So these are called as nitroimidazoles. Now, one classical example of the nitroimidazole is a drug by the name metronidazole. So remember, these drugs end with nidazole because there are so many other drugs which end with azole. So remember, when you want to remember this nitroimidazole, they end with nidazoles. So what is the mechanism of action? How do they work? Mechanism of action is when we use metronidazole, it produces nitro-free radicals. Now these nitro-free radicals are generated in anaerobic environment. So this is generated in anaerobic environment, and that's why it is more effective in treating anaerobes. Now what happens when the nitro-free radicals are generated? They will cause DNA damage. So when the DNA is damaged, it will lead to the cell death. So if it is a microbe, it will lead to microbial death. So that drug name is metronidazole. Similarly, what are the other drugs we have in the group? The example is tinidazole. So remember, it ends with nidazole. Let me write one more, or nidazole. Then we have secnidazole, then satranidazole, and one more drug is benzonidazole. Now, benzonidazole is the drug of choice for a condition called Chagas disease. Chagas disease. Now, satranidazole has specialty; it produces less GI adverse effect, and there is a reaction called disulfiram. It causes less disulfiram reaction problem. So these are the specialties. Now once I know the specialty, let me write where do we use metronidazole. So let me write uses of metronidazole. So the uses can be remembered with the mnemonic 3G Pata. I know we have 4G and 5G, and it's 3G Pata. So what is 3G and what is Pata? We'll Pata kar lenge abhi. So 3G stand for giardiasis, and one more G stands for Gardnerella vaginalis, and one more is Guinea worm. So Guinea worm is already been eradicated from our country. So it is also used, metronidazole is also used for Guinea worm infection. Then P for it is used for pseudo membranous colitis. Pseudomembranous colitis caused by which bacteria, can you guess? Clostridium difficile, and it is also used in pylori. So what pylori I am talking about? Obviously H. pylori. So the next letter is A. So A for it is used in anaerobic infections. Anaerobic infections. And next one is T. So T for it is used in trichomoniasis. So it is used in trichomoniasis. Again another A for it is used in acute necrotizing gingivitis. It is also used in amoebiasis, caused by Entamoeba histolytica. There are two important amoebiases, intestinal and extraintestinal amoebiasis. Right, so these are the infections where we use metronidazole. Let us understand where it is the drug of choice. Now, giardiasis, if they give in the exam, remember tinidazole is having more efficacy compared to metronidazole. So usually they will not give both. So if they have given metronidazole in the option, that will be drug of choice. If they have given both, go for tinidazole. Suppose it is resistant for both, then the drug of choice will be nitazoxanide. So we use nitazoxanide. Now, Gardnerella vaginalis causes bacterial vaginosis, and you will see clue cells. What is the drug of choice for that? Drug of choice for Gardnerella vaginalis and Guinea worm, the drug of choice is metronidazole. Then Pseudomonas colitis, pylori, it's not a drug of choice, but it's used. Anaerobic infection also it is used. Trichomoniasis, where there is strawberry vagina. Here also the drug of choice is metronidazole. Now it is also drug of choice for both intestinal and extraintestinal amoebiasis. The drug of choice is metronidazole. So now we understood the uses, and particularly please understand the drug of choices. Commonly asked in exam is the drug of choices. So once we understand this, let us understand what is the adverse effect of metronidazole group of drugs. Now, adverse effect, your favorite, the GIT upset. So I need not tell that, you will only tell it. Nausea, vomiting, diarrhea is common. The second important problem is it can cause allergy. It can also cause something called fixed drug eruption, and allergy and fixed drug eruption, you have to discontinue the drug. Now, another important, remember the drug produces the D's. The meaning is damage to the CNS. Now, what does it damage to the CNS? Remember, if you use it at high dose can cause seizures. Now, another important, if you use this metronidazole for long term, so long term use of metronidazole can cause a neuropathy, and that is called peripheral neuropathy. Peripheral neuropathy. Another important, remember the D for dysgeusia. The altered taste sensation, so patients will complain of metallic taste. Metallic taste. And another important one is disulfiram like reaction. So please underline this, disulfiram like reaction. So suppose patient is on metronidazole, he should not drink alcohol. If he drinks alcohol, he will end up with nausea, vomiting, blurring of vision, palpitation, chest tightness. So one common interaction they will ask you, and recently being asked also, metronidazole should not be used along with alcohol. The reason is it causes disulfiram-like reaction. It can also cause discoloration of urine. The reason for that is cystitis. Cystitis. And remember the 4D adverse effect of the metronidazole: damage to CNS, dysgeusia, then disulfiram-like reaction and discoloration of urine. But in all this, disulfiram reaction is a must-know thing. Must know. So that is about the nitroimidazole. That is about nitroimidazoles. Now let us take specific protozoa and we'll discuss. Let us discuss the management of amoebiasis. So amoebiasis is caused by Entamoeba histolytica, very common infection. So there are two important strategies to manage it. So there is something called intestinal amoebiasis and extraintestinal. So what do you mean by intestinal? If the infection is mainly in the intestine, it doesn't spread to systemic, then it is intestinal. But if it goes from the intestine and spread to the brain, to the liver, it is called extraintestinal. Now please remember, for both, what is the drug of choice? The drug of choice is metronidazole. Metronidazole. So the metronidazole group of drug are the drug of choice. Now any other options we have, other drugs which can be used are, there is a drug by the name emitin and dihydroemitin. So these are also used for both. But the problem is these are older drugs, and the name itself is telling you emitin, they increase nausea and vomiting. So that's the reason the best drug is metronidazole. Now there is one drug called chloroquine. Chloroquine, we know that it is used in malaria, but it is also effective for one more condition, that is extraintestinal amoebiasis. It is not a drug of choice, but it can be used. Now another important aspect is the intestinal carriers. So intestinal cyst carriers, so they can transmit the infection to others, and it's important we kill them, not the patient. Kill the cyst. So these drugs are called luminal amebicides. So luminal amebicide agents. Now in luminal amebicidal agent, so what we have is a drug by the name paramomycin. So paramomycin, as per recent guidelines, is the drug of choice to eradicate the carrier state. But in India, we are still using a drug by the name diloxanide furoate. So diloxanide furoate is used. Now what we do actually when there is a case of amoebiasis, we combine metronidazole along with diloxanide furoate. Metronidazole will take care of intestinal amoebiasis and extraintestinal amoebiasis, and diloxanide furoate will kill the carrier state. That is, it has luminal amebicidal activity. That's why they are combined. So that may be a reasoning question in your future exams. Why do you combine metronidazole with diloxanide furoate? Now, is there any other drug? Yes, we can use tetracyclines. Then a drug by the name nitazoxanide. Then we have quin iodochlor. Then iodoquinol. So these are outdated drugs, but remember mainly paramomycin and diloxanide furoate mainly. Anyhow, you already know tetracycline and nitazoxanide. So these are the drugs what we use in the management of amoebiasis. Once we know management of amoebiasis, let us understand the management of leishmaniasis. Now, is it present in India? Yes, it is there in India. So the test what we do is RK39 dipstick. So if this dipstick is positive, that means leishmaniasis. Now leishmaniasis are basically three different varieties. What are those? The visceral leishmaniasis. The visceral leishmaniasis is also called as Kala Azar. It is also called as Kala Azar, and we have one more. It is called mucocutaneous. So for both of these leishmaniasis, what is the drug of choice? The drug of choice is liposomal amphotericin B. So liposomal amphotericin B is the drug of choice. If they ask you, what is the oral drug of choice? See, amphotericin B is given injection, that is IV. There is only one oral drug. The oral drug of choice is miltefosine. So that is the only oral drug available. Apart from that, any other drug are used for this? Yes, we have pentamidine, then paramomycin, and sodium stibogluconate, sodium stibogluconate. So these are the drugs. Now moving on to the another type of leishmaniasis, it is called dermal leishmaniasis. It's a mild variant. It's also called as oriental sore. So it's a mild sore. For that, what we can do is we can give sodium stibogluconate local injection. So we can give sodium stibogluconate local injection, or we can give paramamycin ointment. So this is what we mainly give for leishmaniasis. Remember, the most important point you all should remember is the drug of choice is liposomal amphotericin B. And many a times in your exam, they don't give it directly. They will give patient has come with fever and chills, malaria negative, and RK39 dipstick positive. What is the drug of choice? Liposomal amphotericin B. But the only oral drug is miltefosine. So once we dealt with the management of trypanosomiasis, Okay, so the next protozoal infection what we are going to discuss is called trypanosomiasis. Trypanosomiasis. In trypanosomiasis, basically we have two important trypanosomiasis, the African and South American. In African, we have two, the East African and the West African trypanosomiasis. For early stage, what we use is a drug by the name suramin, and late stage, we use melarsoprol. West African, there also we have early and late. So early we use a drug by the name pentamidine, and late we use eflornithine. Usually the questions are very less with this because we don't have that in our country. So still, as a part of integration with microbiology, I am telling you what are the drugs used for these conditions. South American is also called as Chagas disease. So for that, the drug of choice is benznidazole. Benznidazole. Now, alternative drug which can be used are alternative drug is called nifurtimox. So this is the management of trypanosomiasis. So if you see that it is not in our country, African and South American. So the chances of questions are less. So this is the management of trypanosomiasis. Moving on to other protozoal infection, the management of cyclosporiasis and a condition called isosporiasis. So what is the drug of choice? You know the name, it is cotrimoxazole. So it is called cotrimoxazole, a combination of, yes, trimethoprim plus sulfamethoxazole. Then we have cryptosporidiasis. So for this, the drug of choice is nitazoxanide. Nitazoxanide. Then one more important infection is toxoplasmosis caused by Toxoplasma gondii. For this, the drug of choice is sulfadiazine plus pyrimethamine. So sulfadiazine plus pyrimethamine is the drug of choice for toxoplasmosis. Now, please understand, if the toxoplasmosis is seen in first trimester of pregnancy. So if there is first trimester toxoplasmosis, the drug of choice is Spiramycin. So what is spiramycin? Spiramycin is a macrolide, and we know that macrolides are safe in pregnancy. Once she becomes second and third trimester, then we can give them sulfadoxine plus pyrimethamine, or sulfadiazine plus pyrimethamine can be used. So most of the books nowadays give this sulfadiazine plus pyrimethamine is the drug of choice for toxoplasmosis. One more condition is called ballotinidiasis. So for ballotinidiasis, the drug of choice are tetracyclines. One more condition is babesiosis. So for babesiosis, whether it is mild, moderate, or severe, mild, moderate, or severe cases, what we use is a combination of azithromycin plus atavocone. So azithromycin plus atavo can be used. If it is not available, the alternative regimen is quinine plus clindamycin. So quinine plus clindamycin can be used as an alternative regimen. So these are the protozoal infections and what are the treatment aspect what we have to give to the patients. Particularly in this video, you have to concentrate on metronidazole, what is the mechanism of action, where it is a drug of choice, and particularly remember the interaction of metronidazole with alcohol disulfiram reaction and a metallic test. Then you have to remember the drug of choice for visual leishmaniasis is liposomal amphotericin B. And remember the drug of choice for cryptosporidiasis, it is nitazoxanide. And toxoplasmosis, it is sulfadiazine plus pyrimethamine. If it is first trimester of pregnancy, it is mainly spiramycin. So that is about the anti-protozoal drugs. Thank you all.